Greetings, everyone. I am Deliria McEwen. I came to you last week regarding the circulatory system. So this week I'll come to you talking about the upper and lower extremities and the veins and arteries of those. We'll start off by talking about the flow of the upper extremities, and we'll also talk about the aorta, which has three branches. And those three branches, two of them provide blood supply to the head and neck. Those two are the brachiocephalic trunk and the left common carotid artery. Now I'll tell you that of those two, the last one is the left subclavian artery. We'll also look at a couple of photos and pictures of what they look like. Your brachiocephalic, it will split into your subclavian and right common carotid once we start talking about how the flow goes down to the arm. Okay. Here, your superficial temporal artery, which is inside your head, your brain. You'll see your occipital, which, of course, is that cusp. It protects your brain toward the bottom. The internal carotid, your vertebral, which you see your vertebrae here. So this vertebral artery kind of loops. Your subclavian, of course, we just talked about it. It although it supports the head and the neck, it also loops down and it will start going toward your arm, your axillary. Your brachiocephalic trunk down here. Your common carotid, which I always kind of think about is thyroid. Your facial. Now, that vertebral artery, it goes up to the neck to supply blood supply to the spinal cord and brain stem. Okay. We have three branches of the brain. Your anterior cerebral artery, your posterior communicating, your middle cerebral, and your cerebral arterial circle. So it's not three, it's actually four. Then your mental artery, which provides blood supply to the chin. Your superior and inferior labial arteries provide blood supply to the lips, and your circle of Willis. It includes 9 arteries, and it's your right and left internal carotid, your anterior communicating, your right and left anterior cerebral, your right and left posterior cerebral, your right and left posterior communicating arteries. So now let's go back to our head photo. The common carotid, of course, is in the front and then extends up to the jawline. You'll know that your internal carotid artery, it provides blood supply to the brain and eyes, and your external to the head and neck. Your occipital, of course, again, provides blood supply to the scalp and the back of the skull. Your superior thyroid, which is not on here, but it provides, of course, to the thyroid. Your posterior auricular provides blood supply to the scalp behind the ear. And your ascending pharyngeal provides it to the pharynx, of course, or your throat. Linguinal provides it to the tongue. Facial provides it to most of the face. Maxillary, which will be to the top part of or the roof of your mouth and your jawline, and your superficial temporal to the scalp and the ears. One that's not on here is your nasal, which of course provides it to the nose. Now, as I previously mentioned about your subclavian, we'll go down to the arm. Your subclavian, it draws down, extends downward to the axillary, to the anterior and posterior circumflex arteries, and then your brachial. And one I want to let you know, your axillary is equivalent to your armpit. That's one way I know. So your armpit to your arm, which is your brachial. And it says your profunda brachial arteries. Now I'll show you this. Your armpit, axillary to your arm. Go down past your elbow to your radial and your ulnar. One way to know your radial is that when you go to the doctor's office and they want to get your pulse, they're using your radial to get your pulse. Another way is to look at your thumb and go straight down. That's your radial. It sticks out. If for embalmers you're unable to get blood distribution or embalming distribution throughout your arm or your hand, because there are times where you'll have to embalm and inject the fluid to organs independently of others. For example, with bone donors or the organ donors, you may have to inject those individually. But for here, you'll use your radial. If you're unable to get that distribution to your radial, because sometimes hospitals or medical examiners, people, or even you may mistakenly mess up an artery or vein or something, you can go to this ulnar and it will provide the distribution down. So I just wanted to let you know that. But your radial, your ulnar, and then you'll go to your deep palmar. Then you'll go to your superficial palmar, which is hard, and then your digital arches, which are your fingers. For the purpose of here, digital arches for the upper extremities are your fingers. Digital arches for your lower extremities are your toes. Okay? Now we'll talk about the lower or the veins of the thoracic. Now we are saying that the veins, we've already talked about terminating points. Now we're talking about the originating points of the heart, where the veins enter the heart. And of course, we know that it starts with the superior vena cava. You can get it going from the superior or the inferior. We're going to start at the superior vena cava. And then it forms from your right and left brachiocephalic. Your brachiocephalic veins, they form from your internal jugular and subclavian veins. And then your inferior vena cava, which is at the bottom, it forms from your right and left common iliac. Then you have your pulmonary veins, which are small veins in the capillary bed of the lungs. We'll start looking here at your lower extremities, okay? Your legs, your veins. You'll have your aorta, of course, toward the end for the circulatory system or process. From your left ventricle, it goes through your aortic arch to your aorta. And of course, it's like a tube that comes down toward the back. But here, it will then go from your right side, inferior vena cava, to your right common iliac. And then you'll have your internal iliac, because you have an internal and external iliac. Then you have your femoral. Now, with your femoral, of course, if you have to get embalming fluid for distribution to the legs or the lower parts of your body, you can always inject using your femoral vein. You'll have your knee, your popliteal area, which is behind your knee. And this is the anterior view. This side is the posterior view. You have your anterior tibial, which is your chin. And on this side, you'll see that this is the posterior tibial. You have your peroneal, and then you have your dorsalis pedis, which is your foot. That then goes down to your digital arches, of course, toes. So again, from your aorta to your right and left common iliac, then from your internal iliac and your external iliac, you'll go to the femoral. And then the femoral artery has branches, one that will go to your medial and lateral femoral, and then circumflex, and then your deep femoral. From your femoral, you'll go to your popliteal. And then from your anterior and posterior tibial, remember that was on your shin or your area below your knee. You'll go to the dorsalis pedis, which is your foot, and your dorsalis pedis will go to the arcuate artery and to your digital arteries. Now, I'm going to tell you this, from your posterior tibial to your fibular artery, then you'll go to your medial and plantar. So I wanted to point that out. Your plantar, like your arches in your foot. We'll talk about veins of the thoracic region. And you have your zygos system, which are a group of veins that drain blood from the walls of the organs and thoracic cavity. Now you'll have your zygos vein, which it comes from the right kidney to the superior vena cava. So your kidney to your superior vena cava. Then you have your hemizygous vein from the kidney, of course, the right, to the azygos vein. Remember, we just talked about the zygos vein is from the kidney to the superior vena cava, all flowing to that superior vena cava. Well, I say here, which this is the way I remember it starts from the top on the circulatory system. So remember that. I'm pointing here because this is the way I remember up top from the superior vena cava on the flow. Then you have your accessory hemizygos, which empties in your hemizygos vein, which then, of course, is from the kidney on the right side to your zygos, which is formed from the kidney to the superior vena cava. Now we'll have the veins of the abdominal region. That's your stomach. When we start talking about that, we're talking about tributaries. And tributaries, they're veins from larger veins. Okay? They're unlike branches of the abdominal aorta, and they're broken into the parietal tributaries and the visceral. The parietal drain walls around the cavity, and the visceral drain the organs. So I want you to know that. And when we talk about the parietal tributaries, you have the lumbar veins, which drain the walls of the lower back, and the inferior phrenic veins, which drain under the side of the diaphragm. Your visceral tributaries of the vena cava, the inferior vena cava, include the hepatic veins, and they drain from the hepatic portal system. It includes your right and left renal veins that drain from the kidneys and left part of the organs, your right gonadal or ovarian vein, you see? And they drain the right side of the ovaries or testicles, your right suprarenal vein. It drains the right suprarenal gland. And then you have your left suprarenal and left ganglion vein, which all go to the left renal vein. So you have a right side and a left side. Now the hepatic portal system that I mentioned up front, it drains the organs of the digestion in the abdomen. The hepatic portal system, it includes the inferior mesenteric vein, which drains the last half of the large intestine. It also includes the splenic vein, and it has tributaries from the pancreas, the spleen, and the stomach. Remember, tributaries are veins from larger veins. We'll talk about the veins of the head and neck. Now, we talked about arteries first. Now we're talking about the veins. They include the dural sinuses, which are veins that drain the brain and empty into the sigmoid sinus and the internal jugular. The internal jugular, it unites with the subclavian to form the brachiocephalic. I remember that. Internal jugular drains. It unites with the subclavian, which was that vein, that artery that went down, to the arm, and it forms that brachiocephalic. So the external jugular vein, it drains the scalp behind the ear and tributary to the subclavian vein. Lastly, because we're almost done, we'll talk about veins of the upper and lower extremities. Again, we talked about arteries first. Now we're talking about the veins. They are the radial and ulnar. So now I'm going to tell you the flow. We went from here down. Now we're going to go from down upwards. Again, you have your radial and ulnar. First your digital, your palmars, your radial, your ulnar, going back up to your brachial, to your teres major muscle, to your axillary armpit, up to your subclavian. Your subclavian to your internal jugular, to your brachiocephalic, to your superior vena cava. The superficial, and those that I just mentioned were your deep veins. Now your superficial ones, which are ones you can't really see, of the veins of the upper extremity, you have your cephalic vein, to your basilic vein, to your brachial forming axillary vein, and then it goes to your medial cubital vein, which is a small vein between the cephalic and the basilic. We'll now talk about the deep veins of the lower extremities. You have your anterior tibial, to your posterior tibia. Now remember, we're going from the bottom up. Before, with the arteries, we went from the top down. We're going from the bottom up. Your anterior tibial to your posterior tibial. Anterior, posterior. So now we'll talk about the superficial. The superficial are your long saphenous vein, which is from the medial side of the foot to the femoral. Your short saphenous vein, which goes to the lateral side of the foot to your popliteal foot. And that would conclude this week's discussion.